All right. Good evening, everyone. I'm Ed Mahon. I'm an investigative reporter at Spotlight PA. Thank you all for spending your Thursday evening with us. We're looking forward to talking about opioid settlement money and how Pennsylvania counties are using hundreds of millions of dollars to fight the opioid epidemic. For those of you who are new to our programming, Spotlight PA is an independent, nonpartisan, nonprofit newsroom producing investigative and public service journalism about state government and urgent statewide issues. We can't do any of this work without you, our members, and those of you who support our efforts. You can learn more about us on our website, spotlightpa.org. A few housekeeping items. Tonight's event will be recorded and posted on our website in the next few days for those who couldn't be here tonight. Thank you to everyone who submitted a question in advance. If you'd like to submit a question during the event, you can do so in the Q&A section at the bottom of your screen, and we'll get to them towards the end of our program. So tonight, we are going to be talking about Pennsylvania's opioid settlement money. At Spotlight PA, we have partnered with WESA, Pittsburgh's NPR station, to follow this money and see how counties are using it and see if it's helping. We've explored debates over using the money for police officers, prosecutors, and even county coroners. And this is a crucial time for the money. Decisions that people in power make in the coming weeks could influence spending decisions for years to come. So with that, I'm going to ask our panelists to introduce themselves, starting with Kate.
Hi, everyone. I'm Kate Jamarisi. I'm a reporter at 90.5 WESA in Pittsburgh, and I cover social services and safety net issues, which lately has involved a lot of stories about opioid settlement funds.
All right, thank you. And then Jordan.
Yeah, thanks, Ed. Hi, everybody. I'm Jordan Scott. I'm the digital organizing and advocacy coordinator for the Pennsylvania Harm Reduction Network, and I've been following the opioid lawsuits and settlements since the very beginning when it all first unfolded.
All right, thank you, Jordan. Great to talk to you. And Stuart.
Yeah, hi, my name is Stuart Fisk. I'm currently the director of the Office of Behavioral Health at the Allegheny County Department of Human Services. I've been here about 7 months. Prior to that, I've worked as a nurse and a nurse practitioner here in Pittsburgh and in San Francisco in the field of HIV medicine. I was a co-founder of the Center for Inclusion Health at Allegheny Health Network, and have a long history of working with opioid users, doing prevention work, treatment. I've worked in the county jail and worked with for many years with Prevention Point Pittsburgh, the syringe service program here in Allegheny counties. As director of the Office of Behavioral Health, we oversee mental health and substance use services for the county.
All right, great. Well, thank you all so much for being here. I'm really excited. I think we have a great variety of viewpoints and experiences, so I really appreciate it. And Jordan, I want to start with you to sort of get an overview of where we are right now. In 2020, Pennsylvania had about 2,100 fatal drug overdoses. By 2022, we had 5,158. From your work with the Pennsylvania Harm Reduction Network, what are you seeing on the ground and what has been driving the increases?
I think one of the most important things that we need to recognize and understand here is that we have entered this era of a almost completely synthetic drug supply. With the emergence of fentanyl, adulterants like xylazine, and that trend, honestly is going to continue, which is and will make things more difficult to address overdose deaths, treatment issues, healthcare issues, because again, one, we have to be able to know what's in our drug supply. And even when we do know what's in the drug supply, we don't always have the research on how those drugs affect humans, and that's the issue that we faced with xylazine. Providers and healthcare and, kind of across the board have struggled to, update protocols and standards because we didn't have the research didn't exist, right? So, I mean, that's largely, what, I've been seeing, and I think is also really driving that continued kind of uptick or even numbers of fatal overdoses throughout the state.
Yeah. And then Kate, when it comes to the settlement money, can you give us an overview of how much is going to Pennsylvania from the settlements, and how did the state decide the amount given to each county?
Sure. So there is roughly over $1 billion that's going to be going out over the next 18 or so years. 70% of that money is going to go to counties. So the bulk of it goes to our 67 counties. 15% will go to the state, and another 15% will go to the entities that were part of the litigation. The county portion is distributed according to a formula, and that takes into account things like drug overdose deaths, opioid use disorder related hospitalizations, number of naloxone doses administered, and some other factors. So it's not really population, and so some rural counties actually getting are quite a bit, per capita, and the counties that are getting extra money because of their role in the litigation, that's, true for urban counties like Philadelphia and Allegheny County, but it's also in more rural parts of the state, like Fayette and Westmoreland.
And then, so how can this money be spent? And are there ways it can't be spent?
So the spending is guided by a document called Exhibit E, which is a legal document that's part of this settlement, and is online. I encourage people to read it. But just to broadly kind of summarize it, some of the things that it says money can be spent on are prevention, treatment, education, and it does spell out some specific things, Narcan distribution. But a lot is still open of, to interpretation. And I think we're still at a point where a lot is still unclear about what will be allowed, particularly as it relates to law enforcement related spending. And I think some of this is going to kind of be settled by our state's opioid misuse and addiction abatement trust. And I'm sure we can get more into the trust later.
Yeah, and we've been covering the fact that counties had to file their first comprehensive reports with the trust by March 15th, and those reports cover spending through 2023. Kate, we've been going through them a lot. I know, Jordan, you've been reviewing them. What stands out to you about some of these reports and the spending that you're seeing? I'll start with Jordan and then go to Kate.
I think the first thing that stands out to me is it's really just a lot of the same. A lot of the same strategies and programming that we've been doing, for years, if not decades, that haven't been successful. I think for the most part, in a lot of areas, it's been, rebranded and a fresh coat of paint slapped on it. But when you peel it back, it's the same old thing. And this money was an opportunity to really think outside the box and really get innovative.
Mhm. And yeah, Kate, I guess if you talk about what you've been seeing.
I will say I did see a couple things that I thought were kind of creative. Particularly like in Allegheny County, they're doing some interesting stuff with housing. Also some funds related to childcare. And like in Indiana County, I noticed they're going to be investing in like a mobile medical van that's hopefully going to be helpful for treating people in rural areas.
And Jordan, when this money was first announced, how were you hoping it would be spent?
I think largely I was hoping to see it be spent on, innovative ideas, using this as an opportunity to fund, some of these initiatives that counties haven't been able to previously, right? Especially rural areas. Mobile medical vans are awesome. Focusing on, housing is great. And I had really hoped that we could, or, the powers that be could think beyond just the drug use itself and actually focus on those social determinants of health, right? Like those societal issues, whether it's investing in a community center, investing in childcare, investing in after school program, investing in, return to work initiatives, like all the things that when people have access to, they're able to actually focus and work on their wellness. And Kate, did point out, like, there have been, a few counties that are doing, thinking outside the box, right? With housing, mobile medical vans. But I think by and large, it's again, it's the same old thing over and over. Or that's even saying if the counties have even spent money at all up to this point.
Yeah, I mean, Kate, you and I reported on this, but there are, I guess, if you can just elaborate on some of the counties we saw that hadn't spent the money and what they told you about that.
Yes, there was one county which, off the top of my head, I think it was Greene County, had not spent any money at all, although they did say they were working on it, and they did not intend to, let the money go to waste. And I do think that they have some challenges there they are very rural and a small population. But yes, they had not spent any money yet.
Yeah. And then, so Stuart, I guess if you can give me a perspective, I mean, you have a lot of experience in Allegheny County and a lot of different aspects of it. Allegheny County had 693 overdose deaths in 2022, 83% involved fentanyl. That's according to state data. How have you seen this epidemic evolve in the county, and what are the challenges the county faces currently?
Yeah, I mean, I think we face the same challenges that everybody does. And Jordan's referenced some of those things. I mean, and I have to say, going back in 1999, I hand counted the overdose deaths in Allegheny County. There was no tabulation. We had to go through paper records and we counted them up. And we came to the realization that opioid overdoses were going to be probably a bigger problem than HIV, hepatitis C, and other issues, which, has largely turned out to be true. I agree with Jordan that the development of an increasingly toxic drug supply is a huge problem. We're way beyond, the oxycodone problem or, the heroin problem. We have to figure out how to adjust our interventions to help deal with those things. What we're seeing, we talk about the overdose deaths, and those are very real and tragic. But what we're seeing from a medical perspective are increasing numbers of people who are facing amputation because of xylazine and other infections. We're seeing people with multiple heart valve replacements in their early 20s because of endocarditis and from using dirty syringes. The costs associated with, for example, a replacement of a heart valve secondary to infectious endocarditis from shooting dope can be upwards of $500,000 to $1 million. And we're seeing people with 2 or 3 valve replacements by their mid-20s. Those people will, if they survive those, will go on to have a lifetime of cardiovascular disease and chronic kind of disability and medical conditions. So the costs are way beyond what we ever expected to see. So I think it is time, we have to think outside the box. We're really trying to do that here in Allegheny County. We've made got close to over $8 million of investments of opioid settlement dollars already in programs that I think are largely innovative or expanding innovative programs that exist. We're funding programs that, like the mobile medication vans, where we're doing wound care and prescribing very low barrier buprenorphine to people, is in high volume. Are programs that are vitally important to people. We're funding recovery housing. We're funding warm handoffs in emergency departments, but warm handoffs that actually mean something because they connect people to medication and to services and appointments to treatment and transportation, and cover medication costs if they need to. Yeah, we're doing a lot. And I think it's not enough. I also agree with Jordan. We really need to be thinking more broadly. We need to not just be thinking outside the box. We need to build a better box in a bigger box.
Yeah. And yeah, I guess with that, I mean, if you can talk about Allegheny County, how it did and how it is making the decisions about where this money should go. What information is it using? How is it deciding what needs to be the priority?
Sure, yeah. I mean, people need to understand that the money comes from the trust to the county. It doesn't come to the Department of Human Services or any specific office or department in the county. The county executive and various departments kind of submit proposals, and there's agreement about what programs to fund and who gets money. That process is being worked out. We've had a change in administration here. I think we'll have an increasingly transparent process about how those decisions get made, and they'll be made in a more effective manner. We've really prioritized at the Department of Human Services, and I think at the county level now too, that the priorities that we're looking at is first serving a significant number of the people most highly impacted, or at high risk for not just death, but morbidity, serious disease, things like that. We're also funding things that have a strong evidence base that suggests that high impact. So to have an evidence base that suggests that this work has a big impact on people for the better, or it's testing hypotheses that we think, things that haven't been studied well, that we think will work. So we're using some of the money for those kind of things. And then lastly, because the opioid settlement dollars are probably our most flexible funding that we get, there are parameters around that funding, but there's also a lot of flexibility compared to a lot of the other funding we get. I mean, the county spent $113 million, over $113 million in fiscal year 23 on overall spending for substance use disorders. Mm-hmm. Relative to that, the opioid settlement dollars are fairly small, and those dollars are going to shrink in the future. So one of the things that we're struggling with is we can innovate programs, we can start programs, and we can test them and collect data on them, understand which ones are working and which ones we should continue funding. But to continue funding and creating sustainability for those programs is going to be a challenge. So we need state, we need insurance, we need other people to step in and make sure that the stuff that we build that is actually helping people continues to be sustained, and we're not just walking across the bones of dead pilot projects in 5 years.
Yeah, that's really interesting. I want to talk to you more about that as well. And Kate, you and I, we worked together to find out how counties across the state spent the money. And so can you describe for our audience why we did that and what that process was?
Sure. So also, I'm sorry, my neighbor is doing lawn yard work. I'm not sure if you can hear that, but
you sound great.
Well, we were limited in what information we were able to get from the trust about county spending. So we ended up filing right to know requests with all 67 counties in Pennsylvania and also with 10 district attorneys' offices. We divvied up the counties. We made a gigantic spreadsheet, which is what you have to do when you're sending that many right to know requests, and got more than 1,000 pages of records back, basically with the reports the counties had to file with the trust that details all their spending. And just some sort of basic takeaways. I think a lot of counties have kind of an education component that they're doing, something in schools, something education related that kind of stood out across a lot of counties. Many counties also doing medication assisted treatment for people in their local county jails.
All right, that's good. And yeah, so we have those database. We just did an update on it today. It's on our website, spotlightpa.org. It's also on WESA's website as well. And so right now, the Opioid Trust has taken these reports and they reviewed them in May. They're expected to review them again in June publicly. And they're deciding whether to approve programs, disapprove, or seek more information. And when the Pennsylvania Opioid Misuse and Addiction Abatement Trust met in May, one member, State Senator Greg Rothman, expressed concerns about allowing the funds to support syringe services in Allegheny County. Another trust member talked about some of those legal issues surrounding the programs in much of the state. I know there's been action taken in Allegheny County to authorize them using their health powers. Stuart, I guess if you can talk about that, the legal issues, and also why Allegheny County decided to use a portion of its settlement funds for syringe services.
Yeah, so again, full disclosure, I've worked with the syringe service program here for quite a few years, and spent the last several years working in the mobile medication program that works in conjunction with the syringe service program. But we're using monies for syringe services because we see it, and it's not just a belief. There's evidence that shows, a lot of evidence that shows that these programs are highly effective at doing a number of things. One is preventing disease. Two is linking people to safer drug use information that helps people identify what drugs are in the drug supply, and helps give them information and equipment and things to help avoid fatal overdoses. Also, the distribution of naloxone because some of the most effective programs in distribution of naloxone and effective use of it are through syringe service programs, because we're providing naloxone to people who are most likely to be present at a drug overdose and teaching them how to use it. We've documented tens of thousands of reversals over the last probably 20 years through syringe service programs. So in addition to kind of disease prevention, there's also a lot of work that's being done in these programs and effective programs to link people to treatment, to address the social determinants of health of people, to get them food and housing, to get them access to medical care, and get them access to, substance use disorder treatment, and things like that. And they're highly effective at doing that. So to not fund them would be more criminal than starting an illegal needle exchange somewhere else in Pennsylvania, which is currently the case. Allegheny County and Philadelphia County have legal syringe service programs. I think there's a couple of others, but in Allegheny County, it exists as a legal program because the health department saw fit in 2002 to create a legal status, a state of emergency that allows this program to kind of circumvent the state law around drug paraphernalia. It took 7 years to get that status in Allegheny County, and so many other places are still lacking. So yes, we have funded syringe services. We will continue to fund syringe services. It's probably one of the most vital public health programs that we have.
Yeah. And Jordan, your group, Pennsylvania Harm Reduction Network, is advocating for changes in state law to authorize syringe services programs across the state. Why is that important?
Stuart mentioned it, and, when I was listening to the May 2nd trust meeting, my eyes started twitching when Senator made that comment, and it started twitching again when you just brought it up. We're focusing on syringe service programs because we have over 30 years, almost 40 years of research now, right? That it's one of the most effective strategies available to not only reduce transmission rates of HIV, Hep C, to decrease likelihoods of heart infections like endocarditis, abscesses. Stuart mentioned both of those earlier. It's also one of the most effective ways to get people to engage and access treatment, whether that's inpatient, outpatient, medication, social service, referrals. And to put it really simply, to that senator and other, elected officials that have expressed their opinions, I don't care about your opinion. I don't care, because your opinion is wrong. And we don't get to put personal opinions over research and science. And you also don't get to put personal opinions over the death of my friends, right? Because I say it frequently, I'm going to be 38 in like a week and a half. I lost my first friend to a drug-related death when I was 16. I have been burying my friends for over 20 years. The last time I tried to count, I got to 60 and I stopped. So we have to, at some point, one, tell people like, yes, you're entitled to your opinion, but you're also wrong. And you don't get to put your opinion above the science and above the research. You know, one of my favorite quotes is, we have a moral responsibility to disobey unjust laws. And the fact that the Pennsylvania legislature to date has not passed legislation for syringe service programs, like they have directly contributed to the issue. They have also directly contributed to the ongoing issues that, you know, cities like Pittsburgh and Philadelphia face, because they are left holding the bag. You know, if you go into Kensington, I lived on the streets of Kensington. Most of the drug users in Kensington are not even from the greater Philadelphia area, let alone from that neighborhood. But we force people to leave their communities to get access to resources. And like, that's criminally negligent. If anything, like, why aren't we bringing charges against our legislature?
Yeah. So when I talked about trying to get it through the legislature, I mean, it passed out of there's legislation that would authorize it. It passed out of a House committee, I believe in February. But it's awaiting action in the full House, and chances of it going through the Republican controlled Senate are uncertain as well. But when it went through committee, a lawmaker who opposes the bill said it, quote, violates this bright line where we as policymakers would be enabling an evil to achieve that good. That's a slippery slope, which I cannot go down, end quote. Another raised concerns about the impact on neighborhoods. So what's your response as you're advocating for this to those concerns and objections that are happening in the legislature?
I would like to ask both of them face to face if they have ever delivered the news to a parent that their child has died from an overdose, because I have, and I will never get those screams out of my head. I also would ask them if they have ever held their friend while they took their last breath, because I have. You know, my generation, right? I'm gonna be 38, so my generation, we came up during the pill mills, right? That's been, you know, glorified and sensationalized. I can't tell you how many of my friends' kids are being raised by guardians because both their parents are dead, right? We've watched an entire generation be decimated. So again, it goes back to that point of, I don't care about your opinion. And I would love for them to look people in the face who have death after death, that trauma compounded. You know, I get it if people aren't there yet. Okay, like, part of what I do for a living is having that dialogue and facilitating that dialogue, right? You know, meeting people where they're at. But we can't afford to wait for them to get there. And we shouldn't have to. You know, Kate mentioned Exhibit E earlier. If you look at Exhibit E, like, not only does it specifically say syringe service programs, but it also highlights it as a key intervention that states and counties should be funding.
Yeah. And you know, Stuart, I want to ask about a different program in Allegheny County. The county also reported $578,000 for mobile medication assisted treatment. So one, if you can just, you know, if anybody in the audience doesn't know what that is, if you can describe what medication assisted treatment is, and then how this mobile program works and how it's, you know, different from what is a non-mobile program or non-low barrier program.
Yeah, sure. So the mobile medication MOUD serves in a sense for medication for opioid use disorder. And medications for opioid use disorder, there's several of them that are available, including methadone, buprenorphine, which most people also know as Suboxone, or Sublocade, and then naltrexone, which is a complete agonist, which means it blocks the effects of opioids completely. And that's usually known by Vivitrol. So those are medications that have an evidence base that that they're highly effective for treating opioid use disorder. And again, we're funding science. That's what we believe in at the county, and it's what we're going to continue to do. So the science leads us to understand that people need this life-saving drug, like a diabetic needs insulin, or a person with high blood pressure needs blood pressure medication. And it doesn't, regardless of whether they continue to smoke or eat poorly or whatever, they still need those medications because without them, they're going to die. So the function of a mobile medical clinic and the ones that we've developed here in conjunction with Allegheny Health Network and Prevention Point Pittsburgh were to take the drug to the people that needed it the most. And those people we felt were most likely to be seen at syringe service programs. When we started the program, it was, I don't know, shortly before COVID hit. And we ran those programs all through COVID. And what we saw were that many clinics stopped seeing people. A lot of clinics just started pushing people away from treatment. And those people were able to come to parking lots in the snow and the rain and the heat, and on beautiful spring days too, and wait to see a nurse practitioner like myself or a physician to get medication that kept them alive. And these are people who they were scared to death. People are scared. They're scared of the drug supply, and they want relief from it. They don't want to die. And so the drug Suboxone that we were giving people is highly effective at reducing cravings, at keeping people from going into withdrawal once they've stabilized on it. But if they relapse, it also protects them from dying of an overdose because any residual drug in their system is going to help kind of block the effect of the opioid. So we pretty quickly, that program, so it's at four of the prevention point sites. There's a van, a medical provider at each one of those sites, and we're able to do, physical exams. We're able to assess people's medical needs. We can't really provide much in the way of medical needs on the van because they're so busy. We do wound care, and we're increasingly seeing horrific wounds from xylazine. We see sometimes, or I say we because 7 months ago I was working in that program, but that program sees up to sometimes 40 people in a 3-hour, clinic session. And those people keep coming back. The engagement and retention rates are good. They're as good or better than a lot of programs that I know that are brick and mortar in traditional settings. So they're just effective. And it's, to say that syringe services just encourage people to use drugs and you put a drug treatment program right next to the syringe service, literally feet away, and you're seeing sometimes as many people in that treatment van as you are in the syringe service van, and you see people moving from that van to the medical van. It's just a really compelling reason to fund that program, and we hope that we can continue to fund that program. AHN has become more involved in helping to run that program and hopefully expand medical services. So it just made sense.
Yeah, that's really interesting. I'm really curious that as we keep tracking this stuff to look for programs like that or even other mobile programs as well. So really appreciate your providing some details on that.
And I'm sorry, I just saw somebody from Westmoreland County pop on, and we also provided, AHN also provides mobile buprenorphine services in Bolivar up there to an RCO up there.
Is that Allegheny Health Network?
Yes, Allegheny Health Network, yeah.
And then Jordan, I wanted to ask you about another spending proposal. We have a story out today at Spotlight PA. We found 3 counties, Lawrence, Lehigh, and Chester, that spent money to support their coroner offices. What impact do you think using the funds for that purpose can have?
I think largely what we're going to see is an influx of death by distribution charges. I think those toxicology reports are going to be used to, to hunt down and continue to, prosecute and criminalize people who use drugs. I know that there's been several pieces of legislation introduced over the last year looking to amend our current death by distribution law and, make it more punitive and increase, the minimums. And, with that, we will also see a decrease in people that are willing to call 911 or call for help during the event of an overdose. You know, that fear is very real and it's very valid. You know, as a drug user, right, that has an immense amount of privilege, right? Because when I can be out about being a drug user, I have access to all the supplies that I need to make sure that I'm, you know, ingesting a safe supply. Um, I'm also still terrified. You know, what happens if, you know, I couldn't, you know, my family is fully aware that if I ever die because of a drug-related overdose, they are never to prosecute or even attempt to prosecute whoever I purchased those drugs from or whoever I was using with. You know, I think there's a small window of positive opportunity with, you know, getting access to more in-depth toxicology reports, you know, being able to know what's in our drug supply. However, that shouldn't be in the hands of the coroner's office, right? When they work so closely with the DA's office and with law enforcement. Because we do have, you know, a statewide drug checking program, you know, shout out to PA Groundhogs. Um, because even, you know, even in those toxicology reports, you know, if you have somebody that comes in that died of an overdose, if there's 4 or 5 drugs in their system, it's not possible to tell, you know, to determine scientifically which drug caused the fatal overdose. You know, if somebody comes in and they have fentanyl, methamphetamine, xylazine, cocaine in their system, you can't tell. So I just think even though there's like that very small window of positive opportunity, like the margin for harm is so large, you know, and like, and I lived in Lehigh County and I grew up in Chester County. I am well familiar with the DA's office. They will not use it to benefit people. It will be used to just cause harm and further incarcerate people and destroy more families.
Yeah. And we've written about this in the story today. We talk about these drug delivery resulting in death charges. People can face up to about, you know, I think it's up to 40 years in prison under this statute. And so we've seen a rise in those charges in recent years. You know, I think we're gonna get into some audience questions in a few minutes, but just want to get a sense of what comes next. So the trust, they had a meeting in May, a public meeting. They have another meeting in June where they're going to be considering these proposals. Stuart, if you can just walk us through, I think Allegheny County had a number of programs approved. I believe 4 still labeled as under consideration by the trust. What is that process like for the county to go through now? I think you're muted. Sorry.
Of course. Yeah, I don't think it represents a real problem for us. I mean, I think what they're looking for is, are we using the money appropriately to address primarily the issues related to opioid use disorder, which I think all of our programs do. We're pretty clear about that. You know, for example, I think, you know, there's a contingency management program that we're funding called Dynamic Care that provides cash incentives to people to engage in continuing treatment, which does have a scientific evidence base to it, particularly with methamphetamines, but also with opioid use disorder. And so this platform is working with people who use stimulants, but also people who use stimulants plus opioids or just opioids. So we're looking at how that program works, where you know, Allegheny County does a huge amount of work with data to really make sure that what we're doing is the right thing. So, you know, we'll work with that. But because I think their concern was because we're also targeting stimulant users, so people who use methamphetamines. In this program, they wanted to look at it for that reason.
Yeah.
I don't have any concerns that we're outside of scope of Exhibit E or any of the other parameters around this money in any way. Hopefully they'll get this out of their system and maybe go look at some of the other stuff that Jordan just talked about.
Yeah. And Kate, can you give us a big picture overview of where things stand now for the trust and sort of the next steps there?
So the next trust meeting is June 20th. I have not seen an agenda yet, but I'm anticipating it's going to be similar to the last meeting where a lot of the county's spending is reviewed and voted on to be approved or disapproved. And as you mentioned in your last question, there's a number of items where the trust has requested more information from the counties and it hasn't had a final vote. And I expect a lot of that is going to happen on the 20th. Unfortunately, what the final votes are in public, but there is a lot of deliberation that is happening in smaller groups that is out of the public view. Attorneys that we've spoken to and also the president of the Pennsylvania Freedom of Information Coalition has told us they believe these smaller group meetings should be public under the state Sunshine Act, which the trust is required to follow. So stay tuned though for the 20th.
Yeah, and then just last thing, I'll open this up to Jordan Stewart. Is there anything that you're looking to see from the trust, and Kate as well, but anything you're wondering about, anything you're looking to see at this upcoming June 20th meeting? I'll start with Jordan.
To be honest, at this point, like my hopes are so low for the trust. I think they've just continuously shown that they don't have any desire or intention to be transparent with what's happening with this money, what's happening with counties. I think that was really driven home when they disabled the chat on Zoom, right? So there is no option for public involvement, public comment beyond their website. And I've submitted several questions to their website, and the answers I've gotten were probably most likely written by GPT. So in a perfect world, I would love for them to just be transparent and just prioritize community involvement, because that's the only way we're not going to see this money continue to be misappropriated.
All right, I want to dive into some of the audience questions that we have, because they're really good and informative. So I'll start with this first one. I'll see if anybody wants to weigh in on this. This comes from Fred. How will the opioid settlement funds help create expanded certified and licensed recovery housing? Is there a strategy to address counties with settlement funds that at present have no licensed recovery support housing? Stuart, I believe some of the Allegheny County money is dedicated for recovery housing. If you can just weigh in on Fred's question about this funding and recovery housing.
Sure. I mean, I think, yes, we have used money to support recovery housing here in the county, including a family treatment program where people can bring their kids in and stay in the treatment program while they're receiving treatment. I mean, I think it's a legitimate use of these funds, as long as, and the caveat would be, is it a recovery house that's embracing a model that's evidence-based, and that is truly supporting the people to achieve recovery and stay in recovery and get on with their life and provide them what they need to be healthy as they can. So I would just say we need to look at who we're funding, not just what we're funding. And I think that's what we're really trying to do.
Yeah, Jordan, do you want to weigh in on the recovery house issue?
Yeah, I mean, and I'm glad that, Stuart brought up the distinction at looking at, not just what we're funding, but who we're giving this money to. Recovery housing, sober living is a major issue that's not even just specific to Pennsylvania, it's all over the country. Where there's an opportunity to make a profit, people are going to exploit it. In the area of recovery housing, to be honest, it's the recovery community that end up being the worst offenders of that harm. That legislation was well-intentioned, but it doesn't really do much, right? Because it's voluntary. And all it really does is restrict direct referrals from providers or organizations that receive federal funds to unlicensed homes. So there's a lot of loopholes in that. And again, thinking, Stuart mentioned building a bigger box and thinking more broadly. Like, why are we not focusing on more family housing units? Why are we not focusing on co-ed, right? Oh, well, if two people are in a relationship, they need to focus on themselves. No, like, people who are in a relationship, like they need to be able to maintain that unit, right? We certainly don't have adequate programming for women and children's programs, but we have nothing for single fathers. If I had a single father that needed to go into housing and keep his kids, there would be nowhere for me to refer him in Pennsylvania. So, I think I'll just echo what Stuart said, but like really looking at not so much the strategies are important, but where is the money going and to who, right? Because I also know that the state has failed to really follow up on any complaints that have been received about recovery housing. So again, like we can make all the laws and regulations that we want, but if there isn't an entity actually with the responsibility for, accountability and an actual mechanism of enforcement, then it's really just a bunch of words on paper and it doesn't mean anything.
All right, we have some other great questions too. This also great for Stuart and then Jordan. But what metrics should counties be using to measure the success of the programs they're funding? If anybody wants to jump on that first.
Talk to the people that you're referring. Like it's the best way to gauge, how a program or intervention is working. Talk to the people that are actually utilizing it, right? We always talk about, there's a need for treatment or, oh, well, these people just don't want help. Instead of asking, why don't they want the help that they're being offered? Like if somebody is being offered treatment and they want treatment, but they will not go in, like, let's take a look at why.
Yeah. And Kate, we have another question from we have a question from Elise. The question is, can anyone view or participate in the trust meetings, and how?
So you can view them. They are online on Zoom, and if you go to the trust website, there's a link that says, meeting information. And you can also attend the meeting in person, but you cannot really participate in the sense of weighing in in person.
Yeah, they don't allow public comment at their meetings.
Correct.
And then Stuart, you had mentioned this issue earlier, but we have a question from Gabby. Is there any information about how the opioid settlement money will be used to sustain programs beyond the initial spending year? 3 years, I guess, too. But yeah, any if you can speak to the sustainability of some of these programs.
Well, yeah, it's a really vexing question, right? Because if we continue to start programs but don't have some sustainability plan for them, then, like I said, we're walking across the bones of dead pilot projects. And I personally gave that up in my life years ago. I got tired of listening to the crunching. Perfectly good programs that weren't sustainable, but it's a challenge. The opioid settlement dollars we'll be down to like, I don't know, $4 to $6 million a year for the next 18 years in a county the size of Allegheny. That's not a lot of money. So we have to really fight for looking at what these interventions and the utilization of this money has allowed us to do and keep funding the effective programs and not keep funding programs that don't work, because that wastes a lot of money that could be used for sustainability. We have to make sure that insurance, Medicaid and commercial insurance is really covering the needs for programs and helping keep them sustainable. We need to make sure that the 1115 waiver for Medicaid, which is a whole thing, but that would allow us to use Medicaid to pay for millions of dollars a year worth of medication treatment assisted in the county jail. That has been remarkably effective in stabilizing people while they're unfortunately incarcerated, but has also helped them to transition into treatment when they get out. They're, where they used to die when they got out of jail because they weren't treated in jail, they now have an opportunity to stay on medication that works, but it's really expensive. And, opioid settlement dollars are going to fund those programs. It's a lot of money. We could be doing a lot of other stuff with that.
Yeah,
so
that's really
those are some of my thoughts.
That's really interesting. Yeah, we've seen a lot of counties dedicate opioid settlement money for that purpose, for that medication-assisted treatment. So that's definitely something to watch if there's.
Yeah, I mean, they're doing it because the Department of Justice is suing them,
Yeah.
and they're forcing them to do that, which is fine. Um, I mean, it's more than fine, but they're not providing. It doesn't provide a mechanism for funding this program,
Yeah.
and it needs to.
Yeah. And so, yeah, want to get to another question. Someone, John says, "Hi, I live in Franklin County and was told informally our county will not use settlement funds to purchase fentanyl test strips because solicitor believes it could open up the county to liability lawsuits if someone overdoses or dies. So is this really a risk for county governments? Have local or state governments ever been successfully sued for liability regarding drug test kits? Could they also be sued for distributing Narcan?" I don't know if you all have the legal answers or not, but I guess what do you think about the issue of drug testing strips and whether counties should be, you know, funding that with opioid settlement money?
They're legal. They save lives, and yes,
It's
Jordan
it's
probably has more to say.
Yeah.
it's literally written out in the legislation. As far as naloxone and other opioid agonists, like the standing order has been around for over a decade at this point. And again, as far as, drug checking, there's a reason why that legislation and the language in it was written very broadly to cover all forms of drug checking, not just fentanyl test strips, not just xylazine test strips, not just test strips themselves, but drug checking as a whole and all substances. And I forget, I miss what county you said, but I know, like, I heard similar from the new district attorney in Northampton County. And to be honest, like, I want to put them on a spotlight and call BS. Like, I think it's a really convenient cop out instead of just admitting that, no, we don't want to pay for these things because we don't care.
And Alice Bell just stated in the chat a good point that the state does provide test strips and naloxone to counties and other organizations and individuals, and counties should not have to be using opioid settlement dollars to purchase these. They're legal and they're funded by the states.
Yeah, that's very interesting. And I'll say, when you're looking through the documents, I believe Philly and Bucks, they're listed as using some of these funds for drug test strips as well. So we're seeing that happening. Joanna wanted to know, why is the money used to assist homeowners in Kensington? I can take this if anybody else is familiar with this. Jordan, I don't know if you've been following this, but I
Not
can.
super closely.
So yeah, I'll take Joanna's question. So one of the members of the trust raised sort of similar questions at a meeting in May, or more than one, I should say. The records we have made public from Philadelphia's description of this program, it's the Kensington Resident Support Program. It's listed as, I believe, 7.5 million in settlement funds. The city has talked about, in their words, that residents in that area live in a constant state of trauma due to the 24-hour open air drug market, in the city's words, and that the exposure to this trauma increases the risk of substance use disorder among people in that area. And what this program does is it designates money for local schools and parks, home repair, rent relief, and eviction prevention. And the city has also has a separate 3.5 million community healing fund. And sort of justifying this, the city has talked about how programs and strategies do not have to be explicitly stated, or if they're not, just because they're not in Exhibit E as stated as such, that doesn't mean they're necessarily prohibited or excluded from the funding. And so this is the big issue that I'm curious to see how the trust handles in June at the public meeting, because we have heard some concerns already. And so, yeah, I don't know if anybody wants to weigh in, given that, if you have any thoughts about sort of that use of the funds.
I mean, my personal opinion and feelings about the current administration in Philadelphia aside, I do think this is an example of a way to be innovative with this money. Like, so again, like, not focusing specifically on, treatment and recovery, but addressing those societal issues, right? Like rent assistance. If you've ever been somebody who lived paycheck to paycheck, like, and the stress, right? And we know the impact that chronic stress has on people's physical health, their mental health, their emotional health, being able to revitalize playgrounds. Yeah, kids deserve a nice, clean, fun, park to play in. Investing in community centers, like those are great ideas. And I think it's important to acknowledge that, the fears and concerns that residents of Kensington have are absolutely valid. And they should be heard. I live in a neighborhood that has a large unhoused population. I live next door to the trap house, right? I've been on both sides of the fence. I've been the person on the street in Kensington, and I've been the person, who rented in Kensington, right? What I'm going to be interested to see is the actual implementation of this, right? Like, is it going to be low barrier? If people have to jump through a lot of hoops, then it's pointless and the money isn't going to be spent, and it's going to be it's going to be another round of like when we had that rent assistance during the height of COVID, and Pennsylvania left like, I don't know, I think a couple $1 million unspent, and it wasn't for a lack of people applying, but it was the actual implementation and application process.
Yeah. And then I think the last question, then we'll do the closings. But Tina asked how are counties using the funds to support concrete services for infant parents with substance use disorder? And I mean, anybody want to weigh in on sort of just we've heard from some advocates about the desire to see some of this money directed towards children and families. Anybody want to weigh in on sort of that question?
Yeah, Allegheny County has funded a program through the Department of Children's Initiatives, I think what they call it, to fund expansion of childcare, kind of subsidized childcare for infants who were born exposed to opioids, or families who have a substance use disorder, to help give them access to childcare, which gives them some level of stability to access treatment, to remain employed, to keep housing. So though there's, I think, 40 slots a year that have been funded for that. It's not, a ton of slots, but it's targeting childcare for women and families who really need it to do what they need to do. So
All right. All right.
it's, again, those kind of programs they can be incredibly expensive, and the amount of money that we've been given, just not going to cover all that stuff. It does help offset or expand really critical programs so that we can use other funding streams. And I think this is a point someone made in the chat. It allows us to use, other dollars that might be more restrictive, but can also support components of programs, and then use the opioid settlement dollars in a much more flexible way for things like syringe services, where there's not a lot of funding streams that will fund that type of program. So
Yeah.
have to be creative.
Yeah. Well, I think on that note, I really thank you again for joining us, everybody in the chat, everybody in the comments. Thank you for our panelists. It's been really interesting and fascinating. A reminder that this event will be posted on our website within the next few days, and I hope you all have a great rest of your night. See ya.
Bye, everybody.